everybody, it's Dr. Galvin. Was not planning on filming a COVID video today. We were actually filming weight loss, but Governor Cooper here in North Carolina came out and mandated masks, and people are going crazy because, oh gosh, it's terrible, masks are being mandated. And about a dozen people have sent me this thing from some OSHA guy who says masks are useless. And let's talk about masks. This is going to be quick. Listen, masks work. The science is well established. There's very little debate. Masks cut down on infection. Why have we been using masks in medicine for years and years and years? For exactly that reason. Are they perfect? No, they're not. But if we use masks, we will reduce infections. Right now in the South and in many states in the Union, numbers are going up and up and up. If you walk around North Carolina right now, hardly anybody is using masks and the numbers are skyrocketing. Masks prevent people from spreading the virus to others. Do they perfectly work? No, they don't, but they do an incredible job of markedly decreasing the number of respiratory droplets that get transmitted. And that is by and large how this virus is transmitted. The virus particles are very, very small. And yes, they're smaller than the pores in the mask, but they are transmitted by droplets, which by and large are larger than the pores of the mask. And the masks do a very, very good job of blocking those pores. I was on WCNC this morning, and I think that some of the things I talk about right now are on that interview, but basically I referenced a case in Missouri where there were two hairstylists that were infected with COVID. They didn't know it. They were in that 1 to 2 week period where they were infectious, but they didn't know it. And they took care of 140 clients, and then they came down with symptoms. The Department of Public Health in that town went nuts because they had taken care of all these people while they were sick, and they did contact tracing, and they traced all 140 people. And you know how many people they infected? 0. You know why? Because they were very careful. They wore their masks and they washed their hands and they followed all the guidelines. And even though they got sick themselves, they didn't give it to anybody because they wore the masks and they followed the guidelines. They did all the right things and they protected their clients. So you know what? Wear your masks, follow the guidelines. Infection is exposure plus time. If we do this, if we just be good citizens, we're going to protect ourselves, we're going to protect those around us, and we're going to keep this from getting out of hand. Remember, the cases we're seeing, this explosion of cases, lags. Remember, you're going to be asymptomatic for a week or two, then people are going to get sick, and they're not going to get sick enough to go to the hospital for a week to 10 days after they develop symptoms. The hospitalization numbers here in North Carolina, when we opened up on the 22nd, there were about 560 hospitalizations. Today, there are over 900. Remember, the people that are getting sick today won't be in the hospital for another 7 to 10 days. That 900 that are in the hospital now, a significant number of those people are going to be dead in another 2 weeks. This is a very serious problem. We need to cut it off now. This is the tip of the iceberg. If we don't get ahead of this, we're going to look like New York or Italy. This is serious. We need to take it serious, and we have the power to control it. We just need to take a little bit of personal responsibility, do this simple thing, protect each other, protect yourselves, wear the mask. It's not an affront to your personal liberty. Just do this simple thing. The science is there. It works. Just do this little thing. Protect each other. That's all I'm going to say about it. I'm going to put some references. You can follow the science. If you don't believe me, fine. I don't care, but like I tell you, do your own research. The science is well established. Why have we been wearing masks to protect you in the hospital when we do surgery on you for 100 years? There's a reason for that. It's the same reason we're asking you to do this now. Why have we changed the tune from a few months ago? The reason was because we didn't tell people to wear masks in March, is because we were trying to preserve the mask supply so that the healthcare workers had it, and then we wouldn't be killing those people off. Now there's adequate masks for all, and now we really need to prevent the spread, and these numbers are skyrocketing, especially in the South. And you know, honestly, it's embarrassing. The places that took it seriously, New York, New Jersey, now those numbers are dropping. You know what they're telling the people in the high-risk states? You got to self-quarantine. You can't come here unless you're quarantined for 14 days. It's embarrassing, folks. Come on, we can do better. We can get this under control here. Let's do a better job. Let's protect each other. Take care of yourselves. Take care of each other. Take care of your families. Wash your hands. We'll get through this. See you tomorrow.